For those just joining, we're just waiting a few more minutes for people to come in. We'll get started here in just a moment. Okay, well, we're going to go ahead and get started, even though I know some people will still be joining. We want to give the full opportunity for our presenter today to share with us. Those of you that have joined us so far, again, welcome to our second live chat series. It's the latest in our environmental health series focused on COVID-19 essential functions for the environmental health workforce. My name is Jesse Bliss. I'm the Director of Program and Partnership Development for the National Environmental Health Association. And today, we're excited to have you join us. Environmental health is something that is very near and dear to my heart. And as we look at the impacts that emergencies have on environmental health and keeping public health safety as a priority, it's not always something that comes to the forefront in recognizing what the issues are. And the nature of these issues around environmental health is such that often by the time they are recognized or they raise their heads, you're in a rapid trying to respond to, rather than looking out ahead and kind of horizon scanning to see what's going on. This is an opportunity for us as the nation is beginning to open up and people are anxious to get back to normal, to think about some of these things and talk about some of these critical environmental health issues that they don't go away. In fact, many are exacerbated amidst emergencies and disasters. And so we're looking at what the impacts across the environmental health spectrum are. And today we're going to be specifically looking at things related to water and premise plumbing. So we're excited for today's presentation. Before we get more into the details of the webinar, I'd like to just highlight a couple of resources for you that we have already developed, as well as things that will be upcoming. So we put together a COVID-19 website on our NEHA pages just about 2 months ago. We are about to roll out a new version of that has been completely revamped. And that also includes a new COVID-19 response online community. We're excited about this because it's an opportunity where members can come together and with non-members share, talk about resources, and interact and engage, learn what other people are doing. One of the key things that I'm excited about this for is because telling the story of environmental health and making sure to share what is happening is important as we go forward, and letting others know the valiant efforts that are being undertaken by the workforce across our nation. We also have our recent position statement on COVID-19 that was published, as well as some new work that's coming out now, just-in-time video series. And we've got one of those already up, and another one will be coming shortly. So watch for next week as we roll out some of these new resources, and we're excited to be able to have those available for you. We're also going to be starting a NEHA podcast. We're getting everything lined up for that as well. So lots of new changes that we're happy to share. And so watch for upcoming announcements on those. We would love to have those watching consider membership at NEHA. There are ways that you can request the resources, what you'd like to see for learning. It very much goes hand in hand with credentialing and providing opportunities to connect with others within the field. We have an office in DC as well as our office in Denver. So I actually also head up the office in DC, and we're excited to have support across the nation. So with that, just a few house rules before we begin. Go ahead and start with introducing yourselves. You can just type your name, say hello to the group, your organization, and your organization that's in the chat box, so that we know who you are. And just so that you also know that this live chat is being recorded. The recording will be shared with all attendees, and we'll also share links and resources mentioned via email in the follow-up. So the moderator for today's session will be Dr. Joan Rose. Dr. Rose holds the Homer Nowlin Chair in Water Research at Michigan State University. She's an international expert in water microbiology and water quality and public health safety. She promotes new tools for, excuse me, she promotes new tools for environmental health surveillance and waterborne pathogens through various exposure pathways used in quantitative microbial risk and assessment. She's involved in examining watersheds, wastewater treatment systems, advanced microbiology, microbial diagnostics for bacteria, protozoa, and viruses, and has extensive experience in microbial source tracking. She's also involved in new nanopore technology to monitor pathogens in the environment and droplet digital multiplexing PCR. She's published more than 300 manuscripts. She currently leads the Global Water Pathogens Project, which can be found at www.waterpathogens.org. And she's the winner of the 2016 Stockholm Water Prize and a member of the National Academy of Engineering. She's also the 2001 recipient of the Clark Water Prize and a member of the IWA Board of Directors. Dr. Rose earned her PhD in microbiology from the University of Arizona, Tucson, with a master's from the University of Wyoming. Joan, I'm going to turn it over to you. Thank you so much for joining us today.
Thank you. Thank you, Jesse. Well, it's a pleasure to join you all. I see you're signing in. You're from all over the U.S. And I'd definitely like to reiterate what Jesse said. These are really extraordinary times, and environmental health is so important to the response that our communities need. And water is an essential service. I know we're talking about people that are working in the food chain and our healthcare workers, but those people that are working and providing safe water so that we can wash our hands, taking care of our wastewater, they're incredibly essential to our everyday lives, and particularly during this pandemic. It's really amazing that this is a global response and we're learning simultaneously from each other. I think it's just fantastic and amazing. I really am pleased to be able to introduce Dr. Andy Whelton. Andy is just nationally recognized for his work on water chemistry and buildings. He got all of his degrees and his PhD at Virginia Tech. He's had broad experience with the industry, with government, with the Army. He's been with NIST. And he joined Purdue University a few years ago. He's now an associate professor. And he's in the civil and environmental and ecological engineering. So this department there at Purdue, which Andy has helped kind of shape, is very interdisciplinary, looking at new approaches for taking an ecological look at our systems, our engineered systems, and how we bring them to safety. He is the lead of an EPA center on a right sizing of buildings, and he's been very much involved in premise plumbing and water quality in buildings, and in particular in schools for our children. And so he's been leading this national center, and it's very appropriate that he's the person to talk to us about what do we do about buildings, water quality in buildings after they've been sitting all this time and we've been at home. Now we're going to be reopening. We're going to go back to our offices, back to these buildings, back to our schools. What do we do about water quality? So Andy, I'm looking forward to your presentation. I'm going to turn it over to you.
All right, see my crazy screen? Now we're going to move to presentation. So Joan, can you see this? Nod your head.
I can see it. Very good.
Great. So thank you very much, everybody, for the opportunity to be here. Thanks for Neha for the invitation, and Joan for coming in. Joan's a dual threat here. She was the leader of a National Academy of Science, Engineering, and Mathematics Legionella study, and she is the expert on Legionella in buildings. And so I just want to make that plug now. So if you have any questions about Legionella testing or basically anything about it, we have the nation's and world's expert on phone. This presentation is based on some of the work that we've done, Dr. Proctor and I at Virginia Tech, or excuse me, we both graduated from Virginia Tech, but we're at Purdue University. So we've been responding to the COVID pandemic and helping health departments, building owners, plumbing associations, device manufacturers better understand and predict how their systems are going to respond to widespread low occupancy or low water use in their buildings. At Purdue, as Dr. Rose mentioned, we have a center where we do on-site education. We flew into California after the Camp Fire and put on a public education demonstration for people to understand plumbing systems and safety. We have a YouTube channel set up where you can read and see, download 8-minute videos or just watch them online about plumbing topics. We have right next door, we have an innovation partner, Whirlpool Corporation, who basically commandeered a house and gutted it and put in all these sensors and really cool technology that we work with. We have a plumbing testing facility built at Purdue where we can put plumbing devices that you see and use all the time on the wall and test them out in real time. And then we also do on-site testing and technical support. You can find more information at plumbingsafety.org. It's a .org website, but it is hosted by Purdue University. And we have COVID-specific information. So building water safety resources, if you heard that people should be flushing buildings, what does that mean? We have videos on there about what is the flushing plan, why would you do it, what types of things should people be thinking about, and the like. So you can download all that information there. And just to kind of give you some idea about our involvement with building water safety, first of all, in the last 3 years, there's been tremendous advancement in awareness of building water safety. In 2017, there was a Center for Medicaid and Medicare Services memo that came out that required Legionella testing and awareness in healthcare situations, primarily because in hospitals you have immunocompromised individuals or critically ill that are more susceptible to waterborne disease like pathogens like Legionella. And so there was awareness in 2017 to do something about that in requiring healthcare facilities to take a certain standard of care. In 2017, the US EPA issued 2 national priority research studies, and at Purdue with Michigan State University, Tulane University, several other universities, we secured one of those efforts, and this is what you're seeing a result of. The plumbing industry has been very active in the last several years. They've been even more active in the last 3 months, and I'll tell you about that in a second. And ASHRAE 188 is the standard that they developed in 2018 to start helping building owners understand Legionella, managing the risk of Legionella in large buildings, primarily for healthcare buildings, but it can be applied in other buildings as well. And if you look on this slide, you'll see a whole bunch of different logos on there. And these are all the different organizations that have participated in some way into understanding building water safety in the last 3 years. Getting closer to today, in 2019, the National Academy of Sciences, Engineering, and Medicine commissioned a study that Dr. Rose led, which we'll mention here in a few minutes, about Legionella in water systems and best practices for preventing outbreaks in large buildings. And then I think in the last 3 months, since the pandemic happened, we have seen probably more building water safety awareness in the last 3 months nationwide than we have in the last 20 years. And that is because the COVID pandemic has indiscriminately affected millions of buildings across the country, in rural communities, in urban centers, in urban rural centers. alone. So there is now an awareness about building water safety, that it might be something to be concerned about. And many of you health officials in your health departments are doing a good job in making people aware that, hey, this is something that we need to take really seriously. This has affected schools, gyms, retail, art centers, salons, places of worship, hotels. You know, down in Las Vegas, they have entire hotels, casinos basically empty, government buildings, really college, universities, and more. So this really hasn't left any building untouched. From a plumbing perspective, what we typically see is these devices. If we're walking through a building, we might see water fountains and bathrooms, point of use devices and break rooms. But the issue is that plumbing's so much more complex, and a lot of it you can't see. It's behind the wall. And so, like, from a utility standpoint, if you're thinking about water in a city, all you see is the hydrants, or that there's a building over there. But you don't see the pipes beneath the street, you don't see the valve. And that's the same concepts that happen in building water systems, except you have cold water and you have hot water. So there are several key components of building water systems. Where does the water come from? What should be in it? The service line, the pipe that takes the water from the source, whether it be a pipe under the street to the building or from a well. There's safety devices, including valves, pressure relief valves, thermostatic mixing valves, water treatment devices. You can think of point of entry where it enters the building. Do they treat the water with water softeners and filters or not? Then there's water service and distribution piping. And then don't forget the faucet connectors, right? Those little braided pieces that connect from the stub out to the fixture itself. Those are important. And then the hot water heating systems, the tanks, or the recirc pipes, or the recirculation system. In single commercial buildings can have 3 to 4 loops of recirculation loops in 3 to 4 water heaters, and they may have different set points depending on the application of those systems too. There's pumps for large high rises. You need to push water up to the top of the building, and you generally let a gravity flow down. But you can have multiple pumps and multiple tanks. You might have multiple pressure zones in a building. It's kind of, some of them are like mini cities. And then you can have point of use devices. So all of this will be available on the presentation that we're posting to the website at plumbingsafety.org. And you can click on these links and it will take you to more detailed information if you'd like it. Now the real question here is stagnation. And that's really what is the elephant in the room. Stagnation for us here is little to no water movement in a building. So we've been contacted by building owners who have literally shut down 300-room hotel and had no water moving in it for over a month. That's stagnation. Stagnation can be a minute long, it could be a couple seconds long, or it could be days, weeks, or months long. So stagnation is a problem. Stagnation causes the water to get older. So generally we need to be using and drinking fresh water. And in good situations in the US, we have disinfectant residual, where we have chemicals in the water that keep the organisms, sometimes pathogens that are lining the walls and tanks, against the wall, so not in our bulk water. We have corrosion control agents there too to keep the lead and copper from leaching out. But what happens is when we have disinfectant and corrosion control, and then we use that water, over time, maybe that goes away a little bit, but we refresh it, we use it more often. So the water stays pretty consistent. For old water, for stagnation, that's a problem. So what happens is as we use the water and it goes away, if we don't refresh it, it never comes back. And that's what we need to prevent bad things from happening in the water system, behind the walls, under your feet, and over your head in these buildings, or in the water heaters and such. So really, old water is caused by stagnation, and it could become a problem. Now, prior to the pandemic, stagnation is not a new concept. During short-term stagnation, we know from testing schools and commercial buildings, you could actually have unsafe water after a weekend sometime due to the certain water quality conditions and the pipes or materials that it's contacting. You can also have devices acting as incubators for organism growth if they're not maintained, and then feeding that out into the water system. If your water heaters aren't set at the right temperature. You could basically be facilitating organism growth downstream in the pipes before it gets to the user. So there's a whole bunch of issues that we know about in the short term. And we're also concerned about ingestion exposure, so people drinking contaminated water, dermal exposure, so if that water gets into cuts or other places through your eyes, and then inhalation exposure, and that's Legionella and some of the other pathogens. So we know a lot about water quality under a short-term, like 2-week time frame, but we really don't know much longer than that, and that's what this pandemic is problem. I just want to show you this example here. This was at a school in Indiana, and we took copper samples over a 4-month period when the school was used, when it was actively being used with hundreds of children in it and staff. What I want to bring your attention is the x-axis is distance from the water meter. So this is the piping distance from the water meter. So on this very far down section, about 500 feet away from the water meter, the copper concentration was the highest. And closer to the water meter, the copper concentration was the lowest. And that red line is the health-based drinking water limit for copper in the U.S. for drinking water. So under normal conditions, you can have exceedances of levels that pose a health risk. Now, as Dr. Rose mentioned, there's Legionella is one of the issues that we're concerned about. Many people are concerned about. It's not the only issue, but drinking water systems that use water include cooling towers, hot tubs, fountains, and building hot and cold water systems, as well as faucets and shower heads, can pose a problem. Legionella and organism growth is facilitated by a trifecta of water temperature, right? They like warm environments. They don't like hot environments, and they'll grow in colder environments. They don't like it. Stagnant water, they like everything to be still, preferably, and no chemical disinfectant. So this is what I've used before as an analogy for colonizing Mars. So if it's too hot on Mars, we're not going to survive, but if it's just right, we will. If the wind and the weather is too significantly bad for us, we won't be able to survive there either. So we like it like calm. And then if there's chemicals or oxidants that pose us a health risk, we're not going to do well on Mars. But if we have that trifecta of no chemical, stagnant water, and water temperature, nice lukewarm, then that's the situation for growth. And one of the issues too is for Legionella and these pathogens, you don't really get exposed to them by drinking the water. You get exposed by inhalation exposure. So this is splashing, aerosols, and then you inhale it, and then that goes to your lungs and causes the pneumonia. Now, why is this an issue? Well, there was a preprint paper, so it wasn't peer-reviewed, but it was a study that was submitted for peer review that came out in the Lancet. And this indicates that COVID-19 patients had co-infections. So they had another challenge that they were dealing with while they had coronavirus disease 19. And one of the organisms that they identified was Legionella. So 20% of the patients in this study also had a Legionella pneumophila infection. That is generally required through waterborne disease exposure. So in response to the COVID pandemic, the National Science Foundation, NSF.gov, gave us funding to support the plumbing and public health sectors, which we've done some of, and we're happy to help you with your questions. We've looked at building water safety. What do we know about prolonged stagnation and how bad it's going to get? How do we know which building is going to be the worst? It's a question that we're thinking about. We're actually conducting testing right now. So Dr. Proctor and the team are out in buildings taking water samples right now to see how water quality is degrading and what we can do about it. We're going to be testing devices at Purdue. We're going to basically contaminate them, let them sit in stagnant water, and try to decon them. And then, of course, work on public awareness. So a copy of the study can be downloaded for free. And this was done by 10 individuals, 7 private and public sector organizations. I'll just briefly touch upon those here. What actions can be taken to prevent water quality deterioration? So many of the health departments have issued their own guidance or pushed CDC's guidance forward into the community. That's great. First thing to be done is awareness. Now, I will tell you today, I was on the call with one of the leaders from a major building management organization who told me that there shouldn't be a problem with water because the EPA and CDC initially came out and said tap water is safe. So I think there's a messaging issue that you may experience in your communities. Coronavirus will not be in the drinking water, and that should have been the message. But some people misconstrued that message and said, well, we have nothing to worry about the drinking water and under any circumstances for this pandemic, so we're not going to pay attention to it. So just to give you a heads up, that's a potential messaging issue that you may encounter. To address stagnation, periodic flushing of the system, and I don't mean like turning on the faucet for 1 minute, I mean getting all the water out of the building and moving it out and bringing in fresh water completely. That's really important. Draining plumbing is a pretty extreme thing to do, and I wouldn't do that unless I had expert help and somebody with just specific building. Utility mains also have stagnation, and the utilities have been told to flush and make sure they have fresh water. But as a health department, I would make sure that you push that message forward. And if building owners call you and ask you what to do, ask them to make sure they call the utility to get that in writing that they've flushed the main and everything's fine for the water to be brought into the building. When you have water quality deterioration, like this hotel with 300 rooms that's stagnant, and they shut off the hot water recirc pumps and the water heaters for a month, you got some issues probably. So you're going to have high lead and copper and possibly other things accumulated in that water. You got to get it out. You should be checking to make sure there's no leaks, flushing and cleaning, getting all that water out. Shock disinfection, some states and health departments are requiring it under 28-day stagnation periods. You have to go and shock disinfect. Others are more flexible. And then testing, what do you look for? We're going to talk about that in a second. Professional help's probably going to be needed under those situations. You may talk to a building owner who is concerned about their water and has left their building for a month. They're probably going to need some help. Either you're going to give it to them or they need to go hire somebody to help them. Developing effective flushing plans is not something you simply do. Developing a water management program, and there's a number of issues there. So safety is a big issue, and if you go into a building where flushing is happening, you need to protect yourself. So if Legionella is in the water, the primary exposure route is inhalation exposure. So if they have all the faucets cranked open and it's splashing against the sinks, and Legionella is suspected or possible, OSHA actually recommends respirators, N95 respirators. The American Industrial Hygiene Association also came out with a position on it and said, yeah, you need respirators if you're going to be doing this. So proper PPE is necessary. I've encountered some consultants who don't really understand building water systems, and they've issued guidance, and they didn't actually warn about PPE because they didn't really have the background to understand it. So just be very careful when you're dealing with flushing buildings that may have Legionella or other pathogens in them. Scalding's another issue that you want to consider as protecting yourself against. Technical considerations, your plumbing drains, your plumbing traps, they're probably dried out if people have left the building for a while, and so you need to fill the sink and floor drains before you start flushing, otherwise you create a vacuum and draw in sewer gases into the building. You can't open all the faucets in a building generally at the same time because you'll depressurize the plumbing and you actually won't be flushing anymore. And so you have to flush a number of faucets at once. You shouldn't just tell like a 300 hotel room hotel to open all the faucets at the same time. There's a stepwise process that has to go through it. So who should be involved in monitoring and returning to building safe use? So public health departments, you all are who we're telling people to go to. And we're doing that because you have a tremendous responsibility, and we're here to help too. We talked to Dr. Jajak, the executive director of NEHAR, about this before we came out with these recommendations. And we also talked to AASHTO about it too. And so we're here to help you in your response at the state or county or local level. Communications about risks. Building owners, and I have a friend who's a business person who called me and said, how do I tell my occupants that we're going to do some things to try to make sure that the building's safe without scaring them. Well, building owners have really no background for communicating that type of health risk information. And you have a better background than they do. You have some awareness or even field experience. So they're probably going to be coming to you about that. Utilities, and we've been talking with utilities for a while now, especially the larger associations, they generally don't understand plumbing. They generally don't understand commercial plumbing. So I would not rely on them to be the voice of public health for building water systems. I think it would be the public health department. So when the pandemic struck, there was absolutely no guidance documents about building water, stagnation, and recommissioning. There was zero. And today, there's more than 45 different building water, stagnation, recommissioning guidance documents. These have been developed by at least 13 nations, state governments. We've seen them across the country. We've been posting them online. City governments, public and private utilities, contractors are approaching business owners and even health departments with these. Trade associations, even device manufacturers are coming up with how to flush buildings or how to clean buildings. And I can't imagine how complicated and confusing it might be because they're all different. There are some commonalities, and I would say the commonality is they all focus on building water systems. But some of them only focus on Legionella, some of them only focus on lead, some of them are issued by two agencies in the same state that kind of conflict. And so just to kind of boil down what we know, you want to keep the water moving. So if somebody calls you and says, I'm really not sure how to manage my building during low occupancy, well, keep the water moving. You're going to have to keep it moving through there. Try to keep it as used to normal occupancy as possible. You want to tell them clean the devices and equipment, water heaters and aerators, water fountains, flushing, keep that water fresh. And then you want water heater and recirculation. You don't want them to shut them off. When you shut them off, there's restart. When you restart, it's a little more complicated. Another thing is plumbing recommissioning actions. The plumbing industry invokes this standard called ASHRAE 188. It's not adopted in all states and localities for new construction, but it basically says if you build a new building and you put a plumbing system in, you have to shock, disinfect, or use super high oxidant concentrations like chlorine within 3 weeks of occupancy. And if occupancy is delayed for more than 4 weeks, you have to fully shock, disinfect the entire building. And so there is no evidence for what to do with existing buildings. There's only evidence what to do with a new building. And, this is really complicated for building owners, but we're here to help you if you have any questions about this. You can learn how to create a flushing plan online. As I mentioned, these are 8-minute videos. They're really good. They got a couple hundred hits already, and we've been receiving feedback from all sorts of people and making new videos on request. The next couple slides, like I said, this is all going to be posted online for you. The next couple slides kind of just reiterate some of the recommendations that we had for health departments about what to do. And so in the short term, what you can do, a lot of you, your health departments have gone ahead and delivered guidance to building owners. You've raised the level of awareness, which is amazing. This is going to be going on for a while, this low occupancy, social distancing, physical distancing issues. So these buildings are going to, they may not have a problem right now, but they could develop one over the next several months. And since 5.6 million buildings are affected in the United States, even a small fraction of that could be 100,000 buildings that may have a waterborne disease outbreak or such. So the numbers are not insignificant, and we just want to keep beating that message in as building water safety, keep the water moving, in providing that to prevent another public health risk. Longer term, health departments can prioritize, oversight of water being restored. I know that there's a school in town here that said already that they need 2 weeks to get ready to get back to school, a daycare center. I had talked to them and they weren't thinking about water at all. I said, what do you mean the water? I thought the water was safe. So there's an issue, messaging issue. Go towards those sensitive populations. Make sure that they have the understanding about what they need to do, and if they don't have the money to do something, then I think this is where a bunch of public health departments might be able to come together and provide some type of standard guidance. We're happy to help with that in any way. You're going to be asked a whole bunch of questions, and I'm going to click to the next slide. You know, these are the questions that we've been asked already. I'm not going to read through them all, but these are the questions that we're being asked by building owners. You know, somebody said we had a Legionella hit in our building. What do we do? And so that's actually a really bad question because generally you shouldn't be testing just to find stuff. You should be testing with a purpose and then planned actions after that. So, you know, recommending Legionella testing is fine and great, but knowing what the typical response would be. And you may have building owners come to you and ask, hey, like, so I found this, what do I do about it? There's a lot of work that needs to go into that. So, you know, we, Dr. Proctor and I and Dr. Rose are very interested in learning about your experiences, the questions you've received, and helping you. You know, we just started a course here, Building Water Systems, for undergraduate students to kind of get up to speed on this because there's nothing like it in the United States, and we're trying to kind of raise the level of awareness. We hope to transform it towards public health officials soon too. And, you know, ultimately, thanks for doing what you do. You all are, some of you are being retasked on missions that you were not necessarily trained for in your exact position, but you're involved in helping tamp down this pandemic and saving lives. So thank you. I'll turn it back over to Dr. Rose.
Thank you, Andy. There's a lot of information in that presentation. And we've got some very good questions coming up through the Q&A. And just to remind the audience, yeah, if you type up your question in that, it's right next to the chat box, we'll get at it. Okay. So, Andy, one of the first questions was, how soon before opening up should you start to get the water moving and start all the things you need to do? Is it a month before people are going to take occupancy, a week? What's your recommendation?
One of the issues is it depends on what your reoccupancy plan would be. So if the health department requires testing, Legionella testing, it would probably be 2 weeks before you would get data from taking a water sample and then growing the Legionella to determine if it's alive or dead, and then making a decision about that. And so I would say that's one of the milestones. If you're going to require testing, that's going to be one. Another thing is that if you take water samples for lead and copper, some laboratories have longer hold times. I mean, you can pay more for it, but I don't know if a building owner would do that. So there's this processing time that's going to be there that's going to prevent it. As far as how should you get the water moving, if a building owner calls you and says, what should I be doing? You ask them, have you been flushing your building? And they say, no. You said, well, you should start. After you get off the phone, go do that now because you need to keep that water moving. It's like a car leaving outside for 5 years. You know, do you expect it to work in 5 years? Fine. If you just leave it there. So we shouldn't expect our plumbing system to do the same either, especially since we're exposed to what it is.
Are there special considerations for educational facilities, for schools, and especially for kids, for young kids, elementary schools?
So there are concerns, not necessarily for children. Certainly lead and copper would be an issue that I would be concerned about. And EPA has demonstrated concern for. State health departments and states have issued, testing requirements for schools and allowing only certain amounts of lead in the water. Those are under prescribed conditions. This is stagnation conditions. So we're like well outside that. So the water that people may be getting is not in accordance with what people designed all these testing standards with. So really, you're going to have to apply some testing to some degree for schools. I'm recommending it for daycare centers. You know, I think it's important to know if an infant's formula is being made with leaded water because the water is spending too long inside the building.
Sure.
The other thing too is immunocompromised population, people with pre-existing conditions. You can't ask people on their job application, you know, when the pandemic hits, I need to know if you have a pre-existing condition so I know that I have to protect the water in this building. There are probably people with pre-existing conditions in these buildings anyway, not necessarily children, but adults. So I would not forget about focusing on these adults too, who you can't actually ask because it's not appropriate. Does anybody have any diseases or you know, problems, health problems that I need to know about? I mean, so just protect everybody. Yes, focus
Right.
on the immunosensitive.
And Ned, what about the biofilms in these systems? How do we handle, even understand whether there are biofilms there? And then maybe try to control or reduce biofilm impact on the you know, on the water column. And does the shock treatment you mentioned, the heat shock or the disinfectant shock, does that help remediate biofilms?
So I've seen conflicting data on thermal disinfection. It sometimes works, sometimes doesn't. I've seen when you deal with like chlorine disinfection, like free chlorine disinfection, I've seen different dosages recommended for different time periods, and even like the plumbing industry doesn't agree upon what's appropriate. And so I've also seen there's monochloramine superchlorination that's done. So I would say that, you know, their chemical methods are probably more reliable, more effective, but there's a whole complexity associated with that. And Joan, I want to kick it back to you about biofilm, because you're the expert.
Well, yeah, I mean, we know biofilms are being produced, and I think that they may be more dynamic than we think. You know, they don't just form and then they're stable. But monitoring them is very difficult, you know, what part of the pipe, and, you know, I like the idea of monitoring exposure sites, especially for kids where, you know, they're going to be drinking water, or you're going to be making formula or whatever it is, and then monitoring for the constituent of interest. Certainly, I think the Legionella testing is a little tricky. One of the questions in the Q&A box here was about whether Legionella risk is you know, related to the age of the piping system, the age of the building, the plumbing, that kind of thing. Do we have any indication that we've got indicators of Legionella risks that are more readily available to us, right? Have you run across, I mean, we know stagnation, obviously, green buildings, things where water use is lower. That's clear that that's a, you know, a factor in Legionella potential growth in the system. But what about just the age of the building or plumbing type or anything like that? Do we have any ideas that there's a relationship there?
So, I mean, in the 7-year-old school building that we tested, there was extensive Legionella contamination throughout, in the cold and hot water. And they didn't know that because they didn't test for it until we showed up. They did lead testing and they got a clean bill of health on that. So, you know, I don't know if there's enough data right now for us to narrow down the types of buildings or the age of buildings. But I think in your study shows, I think, that there's a trifecta: water temperature, low use, and there was something else. Oh, no disinfectant. And if you have those three monsters at the building, now you have to pay particular attention. That's why I'm pushing get that water moving. Like, there's a couple things you can control, and one of them is moving water through the building.
Right. Yeah, exactly. Yeah, we did a study on the campus, and we have very old buildings from the 40s to very new buildings, and it wasn't really related to age. It was more related to how far it was from the reservoir. So that freshness issue, however we try to measure that, that's coming into that building. You mentioned copper and lead quite a bit. What about other ions or other metals of interest? What about manganese and other things? Are there other things that should be on people's radar in addition to copper and lead?
Yeah, definitely. When you have stagnation, you're gonna basically mechanically your scale is used to pressure or shear forces, and then when you have stagnation, you may grow scale, or there may be point corrosion events that cause loose scale to develop, and then when you start flushing, you may dislodge that, and you'll have particulate manganese. So generally, manganese in water generally can be manganese dioxide, which is a solid. But you can have some dissolved manganese as well and some other complexes. So yeah, that would definitely be a concern too. And you could have nickel from scale and chromium from scale and such. And you know, one of the issues too is just because you have lead-free faucets and fixtures doesn't mean that your building's lead-free, because by definition in federal law, lead-free is allowed to contain lead. So
Yeah.
under extensive stagnation, you will have potentially lead at levels that exceed safe limits. So that's an issue.
Yeah. The testing, I think, is something that is quite interesting. I mean, broadly testing for all these metals, and of course chlorine residual should be pretty easy to do, maybe pH and other things, but for these metals and even Legionella, it's quite complex. Do we have any new advances coming out that allows building owners to, better monitor their water quality or get the results faster?
So that's a great question. Many people said, do I have to hire a certified lab to do all this stuff? Because nobody's going to do it. It's too much work. So that you can buy Hawk, like handheld color kits, like the pool kit, except it's a handheld digital one.
You have to buy those online, Andy? You buy those online? Okay.
$400, $500, and you can do your own disinfectant monitoring, and it's cheap. I mean, comparatively. So if you have a thermometer, that would help too, right? So if you know that you're bringing cold water in, or you're getting hot water to a fixture, that's another inexpensive way to find out. So I recommend to all building owners. As far as the other tests, lead and copper sampling, that's going to be more expensive. But there's simple things that every health department can do if they were called to a building and asked to check. Is the water safe or not? I mean, that's a loaded question, but you can do some quick tests with disinfecting kits that are cheap and temperature probes.
Right. And that goes to your point of really preparing, I think, and doing this a month in advance. Get the water moving if you haven't. Start the testing, because the Legionella, of course, is going to take a couple of weeks. It's just the nature of the culture method that, it takes so long for the Legionella to grow. It's quite frustrating when people are trying to, when they do, like you said, get a positive, and then they remediate, and then they have to wait, another 2 weeks for the next set of results. And so I think trying to develop these relationships in buildings, like chlorine residual against, against the likelihood that you're going to have this culturable bacteria, is really important.
Definitely, and I would not be surprised to find no disinfectant residual in the building. I would not be surprised under routine situations to find no disinfectant residual. And one of the points I'll caution you about for the listeners is, and Dr. Rose knows this, is there are tests, molecular methods, to determine if Legionella DNA is present. And it doesn't tell you if the Legionella is alive or dead. It tells you if the DNA is floating around in the water. So, the gold standard right now is culturing, literally taking the water sample and growing the actual pathogenic organisms and then seeing it. And that's something you need to be careful about, because if you're recommending these molecular methods, Legionella may not really be alive. It might have, dead coming in from the city, Maine, or something like that. So Dr. Rose, did you want to comment on that?
Yeah, I think the value of the new tools, the new molecular tools, is they're fast. The problem is we don't have enough information about what's background. What would we find consistently with these new tools? And when they go up, what does that mean? At what level? And so I think we have to use them a lot more and try to understand change in concentration. That's the important thing. With remediation, can we show that we've cleared out, if we get a positive, that we've cleared out some of the numbers? So I think they're going to have some value because they're rapid, but I think we're going to have to decide how we're going to use them as we look at buildings and remediate buildings. Culture is still going to be something we're going to want, just because we want to know whether the bacteria is viable and able to cause infection. I have some other questions here that I think are quite interesting. We heard that revenues are dropping for the utilities, their water use is going down actually. Is there stagnation or potential for the water main itself to contribute to contamination of the buildings?
Oh, 100%. I mean, that's where the Legionella comes from, into the building. I mean, it's seeded into the building, so it doesn't generally come through the air. It comes from the water source at low levels and then grows. So yeah, definitely. So the utility, like I'm thinking Inner Harbor, Las Vegas, these big, New York City, the utilities need to be flushing. And if they're not, one way for the building owner to check and the health department to check is to test the water coming into the building with a disinfectant residual, expensive kit. And if you've got no disinfectant residual, then you can go to the utility and say, hey, you're giving me undisinfected water. I don't want to flush with that. When are you going to send me water that has disinfectant in it? Because according to state law, in many places, you have to have what's called a, quote, detectable disinfectant residual in the utility water mains. So building owners and health departments can point to that and say, you're supposed to be delivering us disinfectant water, and you're not. You need to do something about it.
Yeah. And so in these buildings, in these mixed use buildings, how do individual businesses try to make sure their water is safe? You've got mixed use, and some businesses are opening in this building, some businesses are not. Do the individual businesses have to kind of form a coalition and go to the building manager, or how does that work? Because you won't have all businesses opening at the same time.
So under legal circumstances, it's going to be the building owner's responsibility to make certain that the building is receiving safe water. And then it will likely be the tenant's responsibility to make certain that the tenant has safe water. So if a building owner has 7 tenants, I just got contacted the other day by a building tenant in Arizona, and they had asked what to do, and they put me in touch with the building manager, and they had 7 other tenants in there. So the fact of the matter is, there's really a difficult situation for the building owner because they can't control the tenants. But if there's some awareness, because you certainly don't want a waterborne disease outbreak in that building, if it's facilitated by the health departments positively, then I think everybody benefits.
Yeah, so really getting to the building owner and those recommendations. Andy, does plumbingsafety.org have testing recommendations on their site? Do you know?
At the present time, it doesn't, primarily because we've been helping people with other other things, but we can put up recommendations just like they're in the PowerPoint slides. The PowerPoint slides are online. So if you need a copy of them, you can email us, Dr. Rose, myself, or Neha.
Great. Okay. And where should they be testing? When a building starts up, I presume cooling towers, shower heads, or taps, what sample sites? Are cooling towers should they always be tested?
So you need to hire an expert on cooling towers. If you have a cooling tower, if you know there are cooling towers, you need to team up with somebody. For your health department, I would then ask the cooling tower folks, what their recommendations are. I think there has been guidance that's come out about cooling towers. In New York City, there's rooftop tanks that have sat stagnant. There's some other tanks and such. So it really depends on what you're trying to do. Schools, they have showers, right? They have showers. You need to figure out what their exposure routes are, not just letting copper at the water fountain, because do people use it elsewhere? And what type of uses you have? Do you have restricted uses in the building for a couple months, and then you kind of peel back that restricted use, or not? These are the things that you need to think about. And whoever's on the phone or listening, feel free to contact Dr. Rose and I, and we'll help you out.
Yeah, I think the whole risk communication issue is one that's needs more discussion, and how do building owners, how do individual businesses in a building, start discussing what they think the risk is and what they should do about it to minimize it. And we're talking about both water chemistry and the biological aspects of the water. And I presume getting more education is one of the first things.
Yeah, and it's going to differ based on the state and the guidelines. Different states have, for example, different levels of detectable chlorine in the water, disinfectant. Indiana requires 0.2 milligram per liter. When we've done testing places, we found 0 entering buildings sometimes.
Well, that was one of the questions too, is there a minimum recommendation of chlorine or chloramines that should be coming into these buildings? And I guess it's state by state. You said Indiana was 0.2, huh?
Yeah, but that assumes that chlorine doesn't degrade in the buildings. It's my understanding that those regulations were assumed naively that the water at the meter is the same as the water at the tap, which is why you hear people saying, "Don't worry, the water's safe at taps," right? So you still hear that kind of unjustified statement. Because the water at the meter is not the same as the tap. So, the greater the concentration of disinfectant in the at the service line of the meter, the farther it may go into the building. You generally won't have disinfectant in hot water. You use thermal conditions to keep that water safe.
Yeah, I think raising the temperature up, the Legionella, the National Academy report recommended that it be raised up to 140 degrees Fahrenheit. And if you're worried about scalding, you have thermal mixing at the taps. And because that higher temperature will definitely help with the hot water portion. I think the idea of measuring at our taps what the chlorine residual is and getting back with the utility and saying, maybe we need more chlorine coming into our building, for sure. There's quite a few other questions here about monitoring Legionella, and it's our ability to detect when it goes into a non-culturable state. And I really like this comment from one of the attendees, Jerry Smith. He says, health agencies should maybe work with their sister agencies in providing post-COVID outreach information and guidance. And work with the Department of Education, Department of Labor and Industry, Department of Ag, the Safe Drinking Water Act primary agency, maybe that the environmental agency. If not housed within the health department. So again, this kind of coalition of people, all the way from the vendor in the building to the building owner to the utility to the health departments, and it's quite a large group of people that are going to be interested and need to be in communication with each other.
Definitely.
Absolutely.
Well, thank you so much, Dr. Whelton, for your presentation, Dr. Rose for moderating the session today. This is great information. For those of you, if you have other questions, either the questions that you saw that weren't answered or you have other questions, please feel free to reach out to us. The email addresses for both Dr. Rose and Dr. Whelton were put into the chat box. You can also email us COVID-19@neha.org. We're taking questions through that route as well. We have come to the end of our hour together. I'd like to, just thank you all for your participation. Also want to put a plug in for next week. We're going to have our next in this series, and it's going to be focused on integrated tick management, strategies and barriers to the prevention of tick-borne disease. This is important. Memorial Weekend is here, right? People have been cooped up in their homes. They want to get out. And unfortunately, we also know that even health agencies have been impacted with their workforce, who have been redirected into other areas. And so some of the vector control functions may have been impacted as well. So please join next week as we talk a little bit more about strategies and barriers, specifically in light of the impacts related to COVID. All of our contact information is contained in the chat box. Also, please, if you don't mind taking a brief survey, it helps us to plan and improve our future offerings. Your feedback is really important to us. So again, thank you so much for joining us today. And from Neha and all of us involved, have a safe Memorial Weekend. Goodbye.
Thank you, Jess. Bye, Andy.